Hi friends, today I have the honor of introducing to you Dr. Rashmi Nain. She is MCI screening score 187 this year, and we are very proud of her achievement. She did her classroom course with DAMS in Delhi for MCI screening, and she has been able to pass this exam in flying colors in first attempt.
Yes, sir.
How are you feeling today?
So this is a great feeling, but I'm relieved first of all that I don't have to write this exam again, and it's an awesome feeling ki ho gaya, that's all.
I think this is the biggest feeling in MCI screening is the relief. I think you don't have to do it again.
Yes, because
considering the pass rate is not so high.
Yeah, there's so much hype about the exam, which is not true. It's a very doable exam, provided that one should know the basics. That's all. Even if we are not able to remember the facts, it's fine. There will be fine 150 questions which will be just like on your concepts, and you can easily do them. So there's just a hype about the exam. It's very doable.
How was your experience with the DAMS classroom course that you joined in Delhi?
So it was really nice. Sitting in the class was a treat in itself. Listening to the teachers, it's like 80% of the job is done. We just have to flip the pages at night. Otherwise, जो teachers ने बोला वो exactly like काफी questions as it is आते हैं. And अगर someone has listened the teacher properly, मतलब वो बहुत ही ज़्यादा useful रहता है.
Any particular teachers that you remember today?
Sir, yes, especially you. I want to thank you. Like the way you taught us in the class, वो घर जाके like दोबारा भी देखने की ज़रूरत नहीं थी. And Anil sir from Gynae, Rajiv sir for ENT. Actually, I want to thank all of them. It would be unfair if I'll take like some names, but yes, right now I can just like recall these names. But yeah, everyone was really helpful.
And you know, what was your strategy when you went back after the class? Did you make sure that you go through the notes on the same day?
Yeah, definitely, sir. Because if we don't revise it this very same day, because one thing is like we have very less time. So we are occupied with the classes, and if we don't revise it, it's like gone. So one have to revise the notes the same day, and so it's very useful. I used to revise the notes and do some MCQs just 50. That's all, because it give an idea like what to do in the exam, because at times we just end up reading the theory and we cannot apply it. So it's also important that we do MCQ on the daily basis, but like not too many of MCQs, but like 50 to 30 MCQs are more than sufficient.
And you know, you also appeared for the CBT, the computer-based simulation test that we conducted in the computer center. You went to give the test. Did that help you to, you know, see and feel how the real exam would feel like?
True, sir. Yes, actually, it was like almost the same kind of exam what like was in the real. At times when we solve the MCQ books, we have a pseudo feeling that the paper would be easy and there will be one-liners, that's all. But in real, the exam was not about just one-liners. Yes, there are one-liners, but they have reduced it to like just 5 to 10%. So it's not sufficient to clear the exam. So, but when I gave the CBT, it gave me the real feel that how the exam would be. There were like lengthy questions this time. So yeah, CBT was really helpful in like letting me know that what would be the real exam.
I also feel, you know, I also want to add here, this is one of the very important things that you brought up. Like what happens is when I see a lot of students who are preparing for MCI screening exam and they have no idea what the real exam would be, they trust the guidebooks which have, you know, which claim to have previous papers and all that, and they start thinking that the paper will be like that. And in the real exam, there are a lot of new things in the paper.
Yes,
and
sir.
it is a longer questions.
True.
And very concept oriented questions are also there. So what happens is if you know, get misguided by just mugging up those guidebooks, you might end up, you know, getting surprised in the real exam.
True, sir.
I think, you know, she's rightly pointed out that, you know, please do not base your preparation only on what MCQ guides are telling you. Try to frame and form basics for every subject. I think that was your basic strength in the entire preparation.
True, sir. So because this exam is asking basic questions which are more than sufficient to just clear this exam, because the basic concept, this is a screening exam. We just have to get 150. So if one is good at their basics, 150 is not at all a tough job to do. And the one thing is, all the one-liners books which are in the market are really of no use, because once we read them, first of all, there are like so many errors in the book. Second is the thing that they are directly taken from the MCQ books, so that answer could be right for according to those 4 options. But in our real exam, the option could flip up, and that option will be there, but there will be a better option, but we would end up marking that answer. So and third thing is that it will be like what we have read in the notes, and if we read something else in somewhere, so in the exam there will be like conflict between what is right and what is wrong. We cannot recall what we have read in the class. So doing the one-liners and MCQs from the guidebook today is not a good idea. It's better if we have,
probably harmful only.
True. If we have extra time, kindly read your notes one more time. That's much more useful than just wasting the time here and there.
Yeah, and she has rightly pointed out that there are many people who claim to give the high yield one-liners for the exam, which is a totally false statement. In the real exam there are not so many one-liners, and the second thing is that in the real exam there are visuals also.
True.
Which these one-liners kind of ignore, and you miss out on easy questions because most of the visuals are not tough, because the visual itself is telling you the answer.
True.
If you are in your approach is always towards the one-liner, you will miss out on the visuals. And the third error that happens is that, which she has actually very beautifully described, is that what happens is, sometimes you may not understand the concept and a guidebook is giving you a one-liner. You tend to do rote learning, but when you are appearing for the exam, the question might be something else and the choices might be something else. But you get biased by the one-liner that you marked up.
True.
And you end up marking it
wrong.
And in the end, and that is one of the reasons, I believe, that is one of the reasons for the passing rate not being so good in the exam, that many students who might be good otherwise get misguided into their 6 months time and running after all the guidebooks, one-liners, and in the end they mess it up.
And one more thing, in the MCQ books we don't have so much visuals. This was my first attempt, but I have heard it from my seniors that the visuals are 5 to 6 or on a lesser number. But to my surprise, when I entered the exam, there were good chunk of visuals this time. I think approximately 25 to 30 if I can recall. So yes, visuals are really important, and these one-liner books do not focus there. So like when someone is reading the notes, kindly go through the visual part also, because it plays a really important part, not just to the clinical subjects but also for the basics. As for the anatomy, there were 3 to 4 questions visual, as if they just gave a muscle attachment. They are showing the muscle attachment and they are asking where this they gave the muscle origin and they asked where this muscle will insert. If you have seen the pictures, it would be easier for you, and if you would just do the rote learning, it would be really difficult. So in that way classes really help, because because in the classes the teacher really teach you the way it should be, and you can really recall in the exam.
You also, when you were doing your graduation, from which college did you graduate from?
Sir, I graduated from Nanchang Medical University, China.
So, and during that time you used to come to dance for your vacation courses as well. So, why did you decide that, and how did that help you in the long term?
Yes. So I'm living in Chandigarh. So there's like everyone is like medical graduate. Let's join DAMS in their foundation courses. The Indian graduate I'm talking. So one of my cousin is studying in the GMC 32. So he suggested me to join DAMS vacation course there. So in that way, I did not have to travel anywhere for the classes, and we get a lot of vacations in China if somebody is graduating, like 2 months in the summer and 1 month in winter. So it's a time of good 3 months. If we utilize that time beforehand, and I did my foundation course, which is like the vacation course for us, because we cannot join the whole classes. So in that way, I did my 9 to 10 subjects. So during this last 6 months, when I had to write the exam, I was at ease. I knew that I'm good at these subjects and I have to focus on other subjects which I have not done. And honestly, like if somebody comes with just this mind frame that in the last 6 months we'll do it, no, one should have a basic knowledge, at least some basic knowledge beforehand, and that's one of the reason for not passing the exam. Like a lot of people say that we will do in 6 months. No, you should be really thorough, not if thorough, but at least some good basic knowledge beforehand.
And I think it is a very good idea that she has done. She did not sit back and wait till coming back to India. So even when she was in China doing her MBBS, she decided that I should be taking guidance during that years as well.
Yes, sir.
And that gave her an idea on how much depth each subject needs to be read. And because sometimes when you're doing it on your own, sometimes you may be overdoing it, underdoing it, or you might be just looking at MCQ books.
True.
And trying to get into rote learning, which is often painful. So important thing is, if you're not enjoying what you're doing, and you are, somebody gives you a book of say 100 facts or 1000 facts, and you're trying to put your hand mugging up, you're not enjoying it. And in the end, the results also don't come in the way you want them to come.
True.
So my suggestion here is that starting early is a good take home message from her, and focusing on basics.
Yes, sir.
Trying and understand each subject to the basics is the idea.
Yes, sir. So, and one more thing, because of the classes, because of the vacation course, I knew what to read from the standard books. It's really tough when we are studying in foreign. We don't have any guide to tell or mark our books like in India that senior do the important things. So we think that it's huge, so we just leave it and we read some notes from here and there. So, but in that way, I joined the classes and I knew these are the important topics, and because when I get back to China, I had huge time, so I read those topics from my book, my standard book, and it helped me to make my basics strong.
I think that all contributed to you getting such a good score at your first attempt. I also want to know from you now that a lot of students who are listening to you today would want to know from you, what were the topics that do you think were more important based on the exam that you gave on this time?
Okay, so for the paper is very unpredictable. The topics, like the subjects which they ask this time, they might not ask those subjects next time. So in that way, and the one thing before coming to topics, it's very important to read all 19 subjects in depth. In depth, I mean, if you have less time, at least read your notes which is given by the teachers, and just don't take the photocopy notes from here and there, because you don't get the concept and you just mug it up, and in exam they would not ask you as it is question, they will ask here and there, and you have to use your mind. If you have listened to the teachers properly, then only you can make out the answer. Gone is that era when the one-liners were the huge chunk. So but this coming back to the question, that this time there was more of ortho than expected. There were good 9 to 10 questions, and biochemistry was on a simpler part. If you have read the notes, it was as it is, and there were new things, new updates about, especially from the PSM, they were asking about the new schemes, very recent one. If you are well aware of, then you can do it, otherwise you don't. It's just a factual knowledge. If you know, otherwise it's okay, you just have to do the guesswork in the exam. And what else? Yes, radio was all good chunk, I think 12-13 questions were there, and they were on a very basic thing. If you have attended a class, you can easily mark them up. So yeah, and everything is important. Suppose this time what they did was they focused more on pre and para clinical, as if in the second paper there were good 20 to 25 questions here and there from different subjects, but they wanted to ask pharma. So it's better if you put your more concentration on first year, second year subjects, which is pre and para subjects. If you do your first paper really well, then I don't think so anyone can stop you from passing this exam. So kindly focus to the pre and para subjects more. You have to do all the subjects, but please focus on the pre and para subjects more.
Another thing that I would like to highlight here is there are often questions which are integrated.
True.
Like, there are questions which start with medicine, end with pharma, or start with surgery, end with anatomy. So it is all possible. So sometimes what happens is you take the marks distribution scheme to heart. This many questions will be there. But in the integrated scenario, the number of questions become more. So I think that is one of the messages that she wants to give here, that please do not miss out on any subject.
Yes.
And definitely do not miss out on basic sciences. You never know how much integration there might be even in the clinical subjects. You may utilize them. And even when you are learning clinical subjects, make sure that you understand them clearly from the basics.
True. Not just ratify the things, because this time there were questions like, suppose they gave 4 statements and in the options they were like which, like A, B, C true or A or B true, something like that. So if we have read just a few lines, maybe 1 or 2, that's not sufficient. You would have to know the topic properly, then only you can solve such questions. So one should be thoroughly read the topic, and in the exam one-liners were really less. So kindly do not focus towards the one-liners and make your basic strongs. If you are reading a topic, make sure you go through the depth properly, because there were good 10 to 12 questions which were like 4 statement, and you have to figure out which one are right. Even if you know the 3 statement and you are not aware of the 4th one, you might end up in marking the wrong answer, and then the score of like less than 150, which is really painful. I've seen like many of my seniors, so it's not advisable to just go through here and then just 1 and 2 line. If you're reading a topic, kindly read it properly.
Clear understanding is the key, I think.
Yes, sir.
You have to understand things clearly. Otherwise, what will happen, even if you know one choice, but some of the questions have choices like A is correct, A plus B is correct, A plus B plus C is correct, all are correct. And if you don't know it, you will mark the wrong combination.
True.
Even if you partially know it, you still mark it wrong. In the exam, there is no like partial marks. They will either give you 0 or they will give you 1. So you lose out on the mark.
True.
That becomes painful, I think.
Yes, sir.
And I think, she has given us good insights for any future aspirant, listening to us today. You need to make your basics strong. If you are preparing early, it is always an advantage. It is always an advantage to utilize your vacations, which you might just utilize in, enjoying otherwise. Why not utilize it in studying?
Yes, sir.
And save the painful time. She has passed the exam in first attempt itself. And another thing that she has told us, the visuals are important. It is not just one-liners. There are questions where more than one answer is correct in the paper. So you form concepts clearly. Basic sciences are important. And there are integrated questions as well in the clinical scenarios.
Yes, sir.
She has given the gist of the entire scenario today. And another important thing she has told us is, do not blindly focus on guidebooks claiming to have previous papers. The real exam might be very different from what you have seen in these guidebooks.
Yes, true, sir. Actually, the exam pattern is not that tough. It's us who complicate it. If it's very simple, if you have like 6 months or 5 months in your hand, kindly revise your notes at least 3 times and give the test. That's very important, because they will give you the real scenario, how the questions would come from, in spite of wasting your times on MCQ. So reading at least 3 times and giving the test is more than sufficient in clearing the time. Again, if you have the time, kindly just go through the notes one more time. That's like more than enough in getting 150 marks.
If I now ask you to describe your DAMS experience in 1 line, how would you do that?
So it was really helpful and it was awesome.
And if I ask you now to say a 1 line to motivate future MCA screening aspirants?
Guys, it's your journey, it's your life. You have to make your life bright. Nobody would do that for you. You have to take the effort.
It is important to take the effort. She took the effort right from her college years. She used to come back home and utilize that time in classes, go back, then again do it, study with her own efforts. Then she came back to Delhi, joined the regular program, gave tests, attended classes. She's worked hard to get to the score that she has today. I am sure we will hear from her more when she gives her PG entrance exam as well?
Definitely, sir.
And should we look forward to take another interview from you at that time?
Definitely, sir.
And, on that note, I wish her all the best from the entire DAMS family, and we are very, very proud of your achievement. I would like to congratulate your parents also on this moment. I'm sure they must be very proud of you today.
Yes, sir. Thank you, sir. Yeah, I would like to thank my parents, especially my mom. She's that motivation force, which is like I'm here. And teachers from DAMS. Honestly, I owe this 187 marks to my teachers and my family. They played a really important role. Thank you, sir.
Heartiest congratulations.
Thank you, sir.
Congratulations.